Hey there, my name's Tasha. I'm the nurse practitioner that's going to be taking care of you today. What brought you in to see us today?
I just came for a checkup.
Can you tell me your name and date of birth for your safety?
My name is Andrew Davis, and my birthday is 12/22/06.
Okay, and we're just going to do a neuro check on you today, okay? We're
Alright.
going to start out with checking your vision, okay?
Alright.
All right, just hold this at arm's length apart from your face, and I want you to read the, cover one eye, yeah, there you go, and read the lowest line that you can.
L T F P H.
Okay, now cover the other eye, okay, and read the lowest one that you can.
L T F P H.
Okay, and then now do them together.
L T F P H.
And that was 20/20 for all of that, so that's, we're checking cranial nerve 1, okay. All right, so let's get down here. All right, and I want you to tell me when you see my fingers flashing, okay? All right.
Right. Left. Left. Right.
Okay.
Left. Right.
Okay, I want you to cover your left eye for me. All right. And I'm gonna close my left eye. And you just, okay, don't look at me. And then you just tell me when you can see me flashing my fingers, okay?
Alright. Okay.
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 All right, cover your other eye. I'll give you a minute to let your eyes adjust. I know that's kind of a, all right. Now cover your right eye. Okay. We're gonna do the same thing. I'm gonna close my right eye.
Okay. Okay.
All right.
Okay. Okay.
All right, very good. All right, and the last thing is look in your eye, and it's not very dark in here, but we're gonna try to make do here. Right here, my nose. Okay, that's good. Look straight. All right, that looks good. So his optic disc looks good, has good margins. There's no hemorrhages, there's no edema, good arteries. Everything looks good in there, so that's good. So what we just checked for was cranial nerve 1. Now we're gonna check on cranial nerve 2 and 3. And by the way, I'm sorry, I forgot to show this at the beginning. I do have a card here that I am using. So cranial nerve 2 and 3, and that's your optic nerve. We're gonna look at your pupils. What do you think? Okay, look right here. That's direct, consensual. Very good. Pupils are equal and reactive, brisk. So cranial nerve 2 and 3 is intact. Now we're going to look at cranial nerve 3, 4, and 6. These are his extraocular movements. So I'm gonna let you look at my fingertip and just follow it. Don't move your head, but just follow my finger, okay? So here we go. Okay, very good. So those are intact. Now we're going to go to cranial nerve 5. So I'm going to have you kind of clench your teeth for me, okay? And I'm going to be feeling of the muscles in your temporal area and your masseter muscles right here that you kind of clench with or chew. So let me feel. So cranial nerve 5 is intact. That's good. I'm going to let you kind of look at this, and then I want you to look at the distance on the wall, and then back at this, okay? Look at this, back, and there, and then back. Okay? And any problems? Okay. So he's accommodation, good accommodation. So now we're going to check cranial nerve number 7. And so, can you raise your eyebrows for me? Okay, can you spread them, put them together? Okay, can you smile? Can you show me your teeth? Okay. Very good. Cranial nerve 7 is intact. All right, so then we're going to check for cranial nerve 8. So I'm going to see if you can hear what I'm whispering.
Donkey? Right.
Yep, very good. So cranial nerve 8 is intact. Okay. We're just going to check some sensation in your face. I want you to close your eyes and tell me when you feel this touching your face.
No.
Okay.
No. 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 No.
Okay, very good. So since his face is intact, we're going to take a look at cranial nerve 9 and 10 now. So tell me, we're looking at your voice, and then I'm going to be looking inside your mouth at your
Alright.
palate. So just tell me your name and date of birth again, just so everybody can hear your speech.
Andrew Davis, date of birth is 12/22/06.
So his voice is good and strong, no problems with that. Again, I'm going to shine a little light here, and this is not a very good light. Hold your head back, and I'm going to look at your soft palate when you say ah, okay? Oh, that looks good. Okay, so while we're here in your mouth, we're going to do one more thing. We're going to check his gag reflex.
Yeah.
So are you ready?
I guess so.
Okay, here we go. Okay, so he's got an intact gag reflex. Okay. And the one thing that I did not do for him on his face is that I did not check his corneal reflex, and that's because he said absolutely not going to do that to him. But I will show you what we would do on a patient. Should we be checking for that? So something very soft like this, just have them look up and away, and then you just barely go and touch their eye. See if they have a blink reflex like that. So he refused to have that.
Yeah.
All right, so we went through 9 and 10, so we checked your voice. So now we're going to check 12. I had to think about that for a minute. We're going to check cranial nerve 12, your tongue. So I want you to stick your tongue out for me, and side to side. Okay, and then go like that. See if you can poke it into your cheek. There you go, very good. So that's intact, very good. All right. So now I'm going to have you just sit up real good and straight for me. And I'm going to put just a little bit of light pressure on your shoulders, and I want you to shrug for me if you can. Okay. Oh, very good. Now I'm going to put my hand to the side of your face, and I just want to see you turn your head over to your left shoulder. Okay, very good. So, do that against resistance. Very good. So cranial nerve 11 is intact. So let's see. I got all that. Now the next thing we're going to check is your coordination. So if you'll stand up for me, please. So I'm going to have you stand and just do quick motions. We're just going to kind of check some coordination, just back and forth like this, just as fast as you can. Okay. And now I want you to go from your nose to my finger, and I'm going to kind of move my finger all around, and I want you to go back and forth, touching your nose and my finger as fast as you can. Okay.
Well, maybe.
Okay. Very good. Very good. All right. Now for your feet, I'll let you sit back down, and I'll just have you tap my hands as fast as you can. Just tap, 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 tap. All right, and now I want you to take one foot and go like this, and back and forth quickly. There you go, and then the other. Okay, intact. All right, you stand back up for me. I'm gonna have you walk back down that way and then back to me. Look at your gait. Okay, and walk back to me. Okay, very good. Now I'm gonna have you walk back down there and then just pause, but I want you to walk toe to toe, toe to heel for me. Okay. Okay. Very good. All right, I want you to walk back to me on the toes, tips of your toes. want you to walk back on the balls of your feet.
What the hell?
Heel. Okay. Very good. Now I want you to jump for me. Okay. I don't think you had to get this jump in place, but that's okay. Very good. So that is all good. So those are fine. All right, so stand with your feet together. We're gonna check your Romberg test. I want you to close your eyes. He's able to stand there. He's not swaying. All right, you can open your eyes. Okay, just stay normal. All right, hands out, arms up. And just close your eyes. No pronate or drift. Okay, you can just relax. Okay, now we're gonna check some muscle strength, okay? So if you'll hold your arms up like this, okay? I'm gonna put some resistance. I want you to just push and pull as I tell you to, okay? So push me away, okay? And then pull back toward you. Okay, very good. All right, and then I want you to push your arms out. And then towards me. Okay, very good. Squeeze my hands right here. Okay. And then your wrist, I want you to pull your hands up towards the ceiling. Okay, do your wrist like this.
Oh.
Up against. Okay, and then push down. Okay, very good. All right, and then pull towards you. You're strong. Okay, push me away. Okay, very good, very good. All right, take your fingers and I want you to spread them out. Okay, and I spread them out, and I'm gonna try to put them back together. Those are not going anywhere. Put your fingers together like this, and I'm gonna try to
Wait, this?
like just like this. Pinky to tip. Okay, and I'm gonna try to break this. Good. Very good. Very good. All right. Just sit down there. All right. And I want you to try to raise your upper legs up against my pressure. Raise them up against my hands. All right, and then pull them back down. Good and strong, equal. Okay. I want you to push my hands apart. All right, and then together. All right. Very good. I want you to push your legs out and then pull them back towards you. Okay, very good. All right. Now I want you to pull your toes up toward, kind of put your, you might scoot back just a little bit, just make it easier on you. All right, pull your toes up toward you. Okay, and then away. Okay, very good. Okay. Just gonna make sure that I cover all of those muscle strengths. So, normal body position, gait was intact, muscles had equal strength. He's strong, 5 out of 5 on all of his muscles. He's got normal symmetry of his muscles, contour, and all of that. So no problems. He has no tics or tremors or anything that I can see like that. So everything is intact as far as muscular goes. We're going to check his sensory to like pain and to like touch. Okay. We're going to start in the shoulders. Do you mind taking your shirt off?
Yeah.
Sorry. All right. I want you to close your eyes for me. I'm going to be doing some light touch, and I just want you to tell me when you can feel that. Okay?
Okay. No. 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 No.
Okay. Can you turn your hands over? Keep your eyes closed. Okay.
No. 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 No.
Okay.
No. 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 No.
Okay. Very good. So, soft touch is intact. All right. I want you to keep your eyes closed, and we're going to do it. You just, this will be a little bit sharper, but it won't hurt you, but I'm not going to poke you hard with it, but I just want you to see if you can feel it, okay?
Okay. Yep. 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 Mm-hmm.
Now I want you to tell me if this is soft or sharp, okay?
Okay. Soft. Soft. Sharp. 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 Yeah, sharp. Sharp. Soft. Did you touch me? Oh, sharp. Soft. Soft. Sharp.
Alright, very good. So all of that, alright, so now I'm gonna put a little object in your hand. And I cannot pronounce this word very well, so I apologize, but stereogrosis, when you can just have your eyes closed and tell what an object is in your hand. Stereogrosis. I'm trying to figure that one out good, but close your eyes, Drew, so you don't know what's going to be coming into your hand. And let's see what I'm going to put in your hand.
What's that bot thing? You showing your eyes?
Yep, that is it, ophthalmoscope. All right. Keep your eyes closed.
Mm-hmm. A.
Mm-hmm.
S.
That's correct. So that's Krapaskis. So he's able to tell what letter. So I did an A and an S in his hand, and he was able to tell that. Okay. All right. So now we're going to check his proprioception, and I'm going to you will have to close your eyes, but I'm going to wiggle your big toe back and forth all kinds of ways, up and down for a few seconds, and then I want you to tell me which position it's in. Okay?
Alright.
That's feels kind of weird. Okay.
Down.
There you go.
Up.
There you go. That's intact. Now, we don't have, okay, so point of localization, so I'm gonna have you close your eyes, and I'm gonna be touching you someplace, and I need you to be able to see if you can open your eyes and point to us and show us exactly where I was touching you, okay?
Alright.
Okay. Okay, so you can tell where I'm touching you, so point of localization. And now we're gonna go to deep tendon reflexes. Now, we don't have a reflex hammer, so we're just gonna pretend like that we have one to check these reflexes. So here we go. So we'll do the bicep. Okay. Did you feel that tingling at all? Would that be?
Yeah, tingle.
So, I'm assuming if we had the proper equipment that these would be normal for him. We're not really having response, but we really don't have the equipment to do this the right way. So, just relax your arm. Just kind of let it free from here.
Tingling.
Okay, tingling. Okay, so those. Generally, if we'd had the right equipment, he would have had a little flinch of his muscles to check for his deep tendon reflexes. So we're going to assume that those would have been normal had we had the proper equipment to do that. So we're going to move on. So we're going to be doing a couple of tests to check for any type of meningeal irritation, like with meningitis. So I'm going to have you lay back if you don't mind. And scoop as far back as you can. Alright. And scoop towards me just a little bit. There you go. And just arms to your sides. And we're just gonna have you raise your head up a little bit. And, okay. So notice how he didn't have any flexion of his hips or try to pull his legs up. So if he'd had any type of irritation, meningeal irritation, he would have had like pain. So he would have kind of pulled up his knees, flexed his hips and up and pulled up a little bit. All right, the very last thing is same thing here is we're gonna move this. Turn eggs sign. No irritation or anything like that, which we're not suspecting any type of meningitis here, so we would expect this to be negative. But if we suspected that he had any type of meningitis or he had symptoms of that, these were a couple of tests that we would do. The first one is Brokowski's test, and then this one that we just did is Kernig's test. And you also can do a straight leg test, which is just a passive raise of his leg. And then, can you pull your toes up towards you? Okay. And then we could expect some discomfort with that if he had some meningeal discomfort. And then, okay, you can set up, and there's one other test that we can do, and that's the asterisks. And it's stop sign out.
Oh, sorry.
Okay, that's okay. Outside, and just have him hold that. And if we seen his hands doing this, it would be a positive test, but he's not having any of that, so you can relax. And I think that concludes everything. I'll let you have a seat. I'll just kind of review and make sure that we didn't skip anything. And I think we covered everything, so that'll be it.